Thank you. I rise to propose Amendment 82 in the name of my noble friend Baroness Bennett of Manor Castle. I did attend second reading and made my views felt then, but I have not been able to be in this bill since because of the pressure of other bills in your Lordship's House. And so even I, as someone who doesn't know very much about medicine, knows that the most urgent challenge facing our health service at the moment is a shortage of nurses. And I have been lobbied very heavily by the Royal College of Nurses because for them, this particular amendment, number 82, is their number one priority. They feel that without a coordinated work plan, without a coherent forward view and knowledge about exactly how the situation is at the moment, then they cannot possibly achieve the sort of numbers that they need. There were almost 50,000 vacancies before COVID, and you can imagine the pressure that COVID has put onto the NHS, extreme pressure at levels completely unsustainable, and staff numbers that are actually unsafe. And we all know this, and yet Boris Johnson and the Conservatives made big promises at the last election. Their manifesto made a promise of 50,000 more nurses, and instantly that number began to unravel as the more nurses, including existing nurses who don't quit, which I think is some very unclever, unsophisticated number crunching. And so I don't understand why this government won't actually live up to its manifesto commitments. One of the reasons I've not been able to be in this bill since second reading is because of all the other bills coming through where the Conservatives say they aim to achieve their manifesto commitments. They're actually going rather beyond their manifesto commitments in lots of areas, but the fact is that they are picking and choosing as if a box of sweets that they prefer. And the Royal College of Nursing represents over 480,000 nurses, and that's in both health and social care. And these are people whose pay requests are constantly ignored, constantly cut. And in real terms, their pay has reduced, just at the point when MPs are getting a very welcome extra pay, while nurses hang on by their fingertips. We know that vacancies are a huge problem, and plus retirement age approaching for a lot of nurses. So nurses need the certainty of planning, and I don't hear those plans coming from the government. And really, this is their job, to manage the economy, to manage society in a way that benefits everybody. And clearly, if the NHS fails in any area, that doesn't benefit anybody at all. So I would argue very strongly for Amendment 82, and I just hope the government wakes up in time to see how necessary it is.